This presentation will cover some important topics about cardiovascular disease amongst Indigenous men, focusing at times on men living in rural areas.
Basic health information. Population: 274,300 Indigenous males living in Australia in June 2009. They account for 2.5% of the Australian male population. Education and employment. In 2004-2005, 38% of Indigenous males aged 25 to 64 years had a post-school qualification compared with 63% of non-Indigenous males. 16% of Indigenous males without any post-school qualifications were unemployed in 2006 compared with 6% of non-Indigenous males. Life expectancy. Indigenous males born in 2005 to 2007 was expected to live to 67.2 years, about 11.5 years less than the 78.7 years expected for all males. Death rates. The number of deaths of Indigenous males in 2005 to 2007 was 3 times the number expected from rates for non-Indigenous males. Causes of death. Cardiovascular disease was the leading cause of death for Indigenous males.
Cardiovascular disease is a group of diseases affecting the heart and the rest of the circulatory system. CVD is the biggest single cause of death and of excess death for Aboriginal and Torres Strait Islanders, and is a leading contributor to the burden of disease among its population in the Northern Territory. CVD accounts for 19.1% of the total disability adjusted life years in Indigenous males. The most common type of CVD is coronary heart disease, which causes heart attacks, stroke, heart failure, and high blood pressure. Physical activity is vital for overall health and especially heart health. Low levels of inactivity, including high levels of sedentary behaviour, are a risk for a range of health conditions. Among the Indigenous males living in non-remote areas, 61% reported they were physically inactive in the week prior to the survey, 1.1 times that of non-Indigenous people. They averaged 5.3 hours per day on sedentary activities, including 2.3 hours of watching television. Poor nutrition is a risk factor contributing to cardiovascular health also. Having access to healthy foods such as fresh vegetables, fruits, whole grains, low-fat dairy products, and lean meats can be a challenge to Indigenous people living in remote locations. Food of this sort is not always available and can be expensive to transport. Only 8% ate the recommended amount of vegetables every day. Middle-aged men, only 3%, females, 7%, respectively, each day. Discretionary foods are highly popular and are consumed as 41% of the total daily energy. This includes foods such as sweets, soft drinks, cakes, and alcoholic beverages. These are foods and drinks that are not needed to provide the nutrients the body requires. Alcohol, also being a discretionary drink, is a high risk for CVD in itself. Aboriginal and Torres Strait Islander people are more likely to not drink alcohol than non-Indigenous people, but those that do drink at hazardous levels, being particularly damaging to their physical health.
The socio-economic status of middle-aged Indigenous males is a largely contributing factor to their cardiovascular health. Unemployment rates were 17% for Indigenous Australians in 2012. This exemplifies the large percentage of Indigenous people that are without a steady income for various reasons. Being at a socio-economic disadvantage due to social determinants and health behaviours is the explanation of between 42% and 53% of the gap in life expectancy of Indigenous and non-Indigenous people. Another social factor which has an impact on cardiovascular health in Indigenous men is levels of education. Although the number of Indigenous people completing school is constantly increasing, only 30% of students completed school to Year 12 in 1998. This would be around the time that men currently considered middle-aged would have been at school. This incredibly low percentage is an example of how low the level of education is in this particular age bracket. Having only completed a few years of school, a person's health literacy levels may be impeded. Culture and connectedness to land, family, and identity is an integral part of overall health in Indigenous men. People living in communities still using traditional languages and various culture practices are less likely to have health issues such as diabetes, being overweight, and cardiovascular disease. The location in which someone resides and how connected they feel to certain aspects of their culture will impact their overall well-being. Living in rural areas has a significant impact on the cardiovascular health of Indigenous men. Having to travel large distances to access primary healthcare is a large deterrent, meaning Indigenous men can go lengthy amounts of time with untreated cardiovascular diseases. Sometimes the conditions of roads, access to transport, and other environmental factors can affect how Indigenous males access healthcare. These environmental factors also affect how accessible emergency services are to Indigenous males. Great distances between where they live and the nearest hospital are detrimental for obvious reasons. The time it takes to be reached by emergency services is a large risk factor for cardiovascular-related deaths amongst Aboriginal males.
In contemporary Australian society, the Indigenous group, and most notably males, are most likely to face multiple barriers to care. Males are known to underutilise healthcare compared to females, and after the age of 14, males are less likely to access Medicare services, have shorter consultations with health professionals, and seem less likely to access preventative services. In recent studies, it has been proven that males who present for clinical care may experience lower quality care than women who present to a health professional for the same complaint. There are many barriers that Indigenous males experience when trying to get access to adequate healthcare. These may include fear that they will be judged, stigmatised, and discriminated, mistrust due to past experiences of discrimination and racism in health services, shame and shyness due to previous negative interactions with authorities, and past experiences of social and other welfare workers who removed children when a parent was sick or for no apparent reason. This barrier or reluctance to engage due to colonial history and past injustices may be overcome by ensuring evidence-based care is provided through culturally safe services and by culturally aware non-Indigenous and Indigenous medical staff. With the introduction of Indigenous medical staff, Indigenous patients are more likely to be comfortable and will be able to access healthcare services more openly. Physical availability is also another barrier that Indigenous males face. 80% of Indigenous males live in rural and remote areas throughout Australia. Therefore, distance and cost of travel limits their access to appropriate health services.
An enabler that will help Aboriginal men to access healthcare are Indigenous support services. There are many government and non-government organisations that provide programs and support services for Aboriginal people around Australia. An example of Aboriginal programs and support services is the Aboriginal and Torres Strait Islander Community Health Service. This is a service which is run throughout Queensland. This is a non-government organisation which aims to provide services such as medical, dental, mental health, youth support, sexual health and family support services, etc., that are culturally appropriate for Aboriginal people. There are many similar services to these all around Australia. Some similar programs in other states are the Aboriginal and Torres Strait Islander Health Unit in the ACT, Aboriginal Health in Western Australia, and the Aboriginal Services Unit in South Australia, which are all striving to achieve better access to healthcare for Aboriginal people. These services are enablers for access to healthcare for Aboriginal people as they are more understanding of what Aboriginal people need in terms of healthcare. These services recognise the need for healthcare professionals and services in rural areas that have a greater idea of the thoughts and lifestyles of Aboriginal people. However, in researching the services, it is uncovered that there are not a large number of services that are specialised to Aboriginal men in rural areas. It is important that there are specific programs for these areas because men are less likely to seek help from health professionals in general. Therefore, there is more chance of men seeking help if they are supported by people who they know understand their situation and potentially meeting people who are going through the same experiences.